Hi, everybody. Thanks for tuning in today. This is Parker from Ogden Clinic's marketing team. I'm here with Dr. David Cope, who's one of our providers at our Bountiful location at Cope Family Medicine. Dr. Cope, it's great to be with you today.
Thank you. It's good to be here. Good to talk to you.
Yeah, it's been a little while since we've talked, and I'm glad that we can connect again. Just because every single day feels like it's a new day with progress, with not only the coronavirus, but just kind of the current state that we live in, and things are changing rapidly. So I wanted to just check in with you because one thing that we've noticed and think is really important that people know is the idea of getting care during the pandemic. And I think part of people are there's a group of people that are a little bit afraid of going into the clinic because of the coronavirus, and I think which is understandably so. But what would you say from a provider's perspective? Why is it important for people to get the care that they need from their providers during this time in the pandemic?
You know, we worry a lot about that there are things that really need to be treated on an ongoing basis, both for chronic conditions or for acute conditions or things like vaccines, things that really we take for granted that we do those on a regular basis. But if you let things slide, there can be consequences to that. And I think every clinic, ours for sure, every clinic that I know of has taken extraordinary precautions to make sure that coming to the clinic is a safe place to come. It was interesting to see last week, maybe the week before now, that the Texas Medical Association published a list of high-risk places, a list of different places you can go, and they quantified the risk at each of those. And going to the clinic is one of the lowest risk places because we're so careful. We make sure that people who are sick don't come into the clinic until they've been cleared for COVID. We make sure that we examine people in their cars before we potentially expose them to the clinic. We have rooms that are designated for just people who are sick and other rooms for people who aren't sick. We do the social distancing in the clinic. The staff is either wearing a mask or they're behind a plexiglass shield to make sure that they're not passing something or getting something from the patients. Just extraordinary precautions to make sure that patients are safe. And if you really can't come in, there's telehealth to stay at home and get the care that you need. But we really worry that people. I had a lady probably 2 months ago now who walked around on a broken ankle for 2 weeks before she came in, and I really felt bad, but she was just nervous.
Yeah, that makes sense. But also, I think you bring up a really good point. Those protocols and precautions are really doing a good job, it sounds like, in keeping our clinics low risk. And I think, if people cooperate also and do their part by wearing a mask and, doing their part to keep it safe, I think that really helps. And that gives me peace of mind as well. So thanks for highlighting those different things. I think it's an important
And
reminder.
the numbers really do bear that out, what you just said. We haven't had any employees get sick from patients, and we have had no patients get sick from employees that we know of. The numbers really bear that out, that we're doing a pretty good job, a very good job to keep people from getting sick from us or us from them.
Yeah. And I think that's impressive. And I think we want to keep it that way. So thanks for highlighting that. One thing I did want to talk about as well is the COVID testing that we are doing at our clinics. That is something that we're offering, especially as the numbers are on the rise in Utah. The test that we have is the rapid SARS test. And I was just wondering if you could kind of explain what that is and how this test sets us apart.
It's really pretty exciting because there's a lot of people that need to get a test done just to be able to go traveling, like Alaska and Hawaii require a test within 3 days of travel. There's a lot of employers who require that. If they've had somebody exposed at work, they require that people have the test. And so the rapid test is essentially a 20-minute test that is very, very accurate. If you have um, the virus, it's pretty accurate to tell you that, yeah, the test is positive. If you don't have it, it's quite accurate to tell you that you don't have it. And it's sort of a game changer. That's one of the ways, if somebody is sick when they come to the clinic, we can do the test while they're in their car or our COVID testing booth, and then hang on for 20 or 30 minutes and we'll have a result, and then they can come in and get examined more thoroughly if the test is negative, or if it's positive, then we can have that discussion about what to do now. So it's a pretty good test. It's the same one that you hear about on the news or you see on TV where you have to go into the nose, and so it's not very comfortable to do it. but it's a lot of peace of mind if it's negative and important to know if it's positive.
Yeah, I totally agree. And I think it does help knowing that you can get your results quickly. Whereas, like in some situations, I've heard of people waiting days or a few days to even find out if they have the positive or negative results. And I think knowing that you can get it within 20 to 30 minutes is really, really awesome. And I think can really help people with their particular and unique situations. So thanks for doing that. So that's offered, is that offered? That's offered at your location, all the locations that we have, correct?
My understanding is all of the Ogden clinic locations, correct.
Perfect. Yeah, so I think
And
that's a great opportunity.
it can be done as a walk-in if you're traveling, and you can call the clinic before and you can call them from your car and just come in and have the test done. Most clinics are set up to do that. If you've not been a patient there before, they'll probably have you come and be seen first, but easily done.
Perfect. Well, thanks for helping give us describe that for us. So moving on, I wanted to ask something that's maybe a little bit more unique, and I'd like to get your perspective on this. You have a unique position as you sit on the CDC National Board, and there's been talk in the past couple of days about a potential vaccine that's in its final stages to help with COVID. And what is your perspective on this? Does it seem like it could be successful, or how is it too early to tell? What would you say to that?
Well, thanks for that. My tenure on that board just lapsed last month, so I spent many years on that, and so I not only on that committee anymore, but I still am involved with the vaccines and very much so with the CDC and the ACIP. And it's been exciting to see the progress. Never in history have we had such progress on vaccines. I think most people sort of know, but you really, until you see them being manufactured and developed, it's hard to really understand the intricacies and the detail that need to go into it to make sure you get a vaccine that works, that it doesn't cross-react with something else that the body's going to be exposed to, that it doesn't cause side effects, that it doesn't be shut down by a previous infection. There's a lot of detail that goes into that. In spite of all that, progress is huge. There's several companies that are in the near to the final stages, one of them that's in the final stages of development. And, we really get our hopes up and we hope it's by the end of the year. Realistically, it'll probably be the first of next year. And even once that happens, to get enough vaccine manufactured, because it's not like you just pour ingredients into a bucket and mix it up and give it. To you have to count out the viral particle antibodies that are in each of those. Very detailed, very specific, and it can take a while to manufacture enough to vaccinate the 330 million people in the United States or the 3 billion people in the world that want or need a vaccine. There's a lot of work going on behind the scenes to make that happen. Once a vaccine's available, they're working through the state and local health departments to distribute it, and they'll probably prioritize certain groups of people to get it first. Realistically, like we're thinking probably the first of the year, the first or second quarter of next year. But
That's
getting there.
awesome. Yeah, and I think it's good to, I think this kind of gives people some hope, if anything, and hopefully it does result in a positive solution for this. But obviously, until then, that's the months away. It's time, a lot of time to pass before we get there. And so I think especially, as seasons are going to be changing, it'll be interesting to see how this whole pandemic plays out, even with that positive perspective on the horizon. So yeah, it's interesting to know that, but like I said, it is interesting to know, and I'm happy to hear that there is a potential solution. So I think that's great to know. But going along with the idea of the numbers rising in Utah, one thing that has kind of been an idea that's been trending as a challenge is the idea of like this moonshot challenge, which is the idea to increase distancing and masking and isolation as needed for the 55 days that are leading up to Labor Day. And I'd like to get your idea or your thoughts on this idea and how you think that this will help the numbers in our situation here in Utah.
Well, I think we all worried a lot when this was starting out, March or April, that we would get complacent or quiet down our resolve to do something about this. And we really can't do that. We really, really worry about what's going to happen in the fall when the weather changes and people are indoors more again, and we could have really bad outcomes if we don't do something before then to quiet it down. And as you sort of alluded to, the vaccine is going to be a while. To get herd immunity, we either need people vaccinated or we need people to have the disease, and we don't want them all to have the disease. And so for that to be quieted down, we need to do all those things that we know we need to do: wear our mask, social distance, wipe down surfaces when we touch them.
Yeah, I think what you say is really important. Just really keeping our guard up these next few months is really going to be telling, I think, of how we're accustoming ourselves for the fall and what we're teaching our kids as they go back to school, because it's also going to play a part in that with that opening as well. So I think, that idea that we're really not going to give up yet or step back or be complacent is a really important solution, I think, and part of solving the problem and being proactive that way.
Well, I think we know what we need to do. It's just a matter of doing it, and maybe on a personal level, not to public shame or to polarize disparity of thought. We all can do what we want to do. I think the personal responsibility is most important, that if we each take care of ourselves, we wash our hands and we stay away from people that are coughing, or we don't touch things that other people are touching, and we avoid handshakes, and we just take care of ourselves, we'll all be okay. We just have to keep doing it. Don't let our guard down, and it'll make all the difference in the world.
Perfect. Well, I think those are some great thoughts to wrap up our discussion for today. And just for those people that have tuned in, this has been Dr. David Cope from our Cope Family Medicine location of Ogden Clinic in Bountiful, Utah. If you'd like to find out more information about Dr. Cope or the providers that are at his location, or if you are in need of a COVID-19 rapid SARS test, those are available at all of our locations, including Cope Family Medicine. Dr. Cope, thank you so much for joining us today. We really appreciate you taking the time and sharing your knowledge with us. And we hope that you stay healthy and keep just doing the great job that you do.
Thank you, Parker. Thanks.